Good afternoon, Richard. Thank you so much for joining me this afternoon and for your willingness to share your expertise with our new graduates. So I'd like you to start out by just introducing yourself and tell us a little bit about how you got involved in your specialty and what you enjoy in particular about this specialty.
Awesome. Thank you so much for having me, Carlene. Yeah, I really appreciate you inviting me to do this interview. So, I I graduated from the University of New Hampshire, the direct entry master's in nursing program last year, and I actually had my undergraduate degree in psychology before I decided to go back for nursing. And I worked for one of the community mental health centers here in the state for several years before I decided to go back. And one of the things that brought me into the nursing field was that I worked with all these wonderful nurses when I was working at the community mental health center, and just saw the impact that they were able to make. And I really wanted to be a part of that. So I kind of knew that I would end up in a psychiatric specialty when I started going back to nursing school. That was a goal of mine. And I think, like everyone else, I kind of found some other specialties I really enjoyed along the way and almost switched out, but I stuck with it and I went into psychiatric nursing. And so now I work at New Hampshire Hospital, the state psychiatric facility up in Concord, and I work on their forensic unit. So I primarily work with patients who are either not guilty by reason of insanity or patients with severe and persistent mental illness who have a significant refractory component to their illness.
Wow, that sounds like a challenging job. Um, Before we go on to the next question, I'm just curious, did you participate in a transition to practice program there at New Hampshire Hospital?
I did their nurse residency program. Yeah,
Okay,
as a new graduate, they have kind of a flexible nurse residency that allows you to move through it at your own pace. So I was hired on as a new grad and went into the nurse residency program before I started.
excellent. That's great. So tell us, why is this specialty a good fit for you? And you alluded to it a little bit, but maybe you can share a little bit more about what attracted you to mental health and psychiatric nursing.
Yeah, I've always had a really strong interest in psychology and psychiatry growing up. I think that especially as we come into, the coming years with the new vaccine technology and the things that we're seeing coming out in medical nursing, um, the mind to me is kind of one of those final frontiers of nursing where I feel like we still really don't have a lot of answers when
Mhm.
it comes to psychiatric care and psychological care. And so just being able to be a part of really trying to figure out where we're going in this field, and every day things are changing and coming out for us, it's something that's really interesting to me. I feel like I'm a part of something that's really still in the process of being discovered. So
Yeah, just to kind of tag along with that thought, I wanted to ask you if you could share what a typical day is for you, because I think, as you said, it's very different. You're not touching people. It's not so much a healing touch or doing things for patients in your field. So, what's a typical day for you?
So a typical day for me, one of my primary roles is like medication management. So I do a lot of medication management with my patients, both providing them with education around the medications that they're on, helping them to find a stable medication regimen alongside the psychiatrist or the psychiatric APRN, and helping them to get used to taking their medications at certain times so that they can get into that routine and get ready for discharge back into the community. But aside from that, we really do a total holistic care of the patient. I mean, I think one of the misconceptions with psychiatric nursing is that people think if they go into psych, they'll lose their medical skills, or they'll get niched into psych and won't be able to transfer back into a medical specialty. And that's just not true. I mean, we do dressing changes. I have patients with chronic wounds that I help them to manage their wound care. I have patients with diabetes, and we provide diabetes education, diabetic foot care. I even do a lot of LNA work. I help people to maintain their hygiene, to shower, and to discover the importance of maintaining your hygiene. And so we do a total holistic care of the patient. And for me, that makes every day really kind of a new experience. It's our tasks. We have our tasks that need to get done: medications, dressing changes, things like that. But then every day is kind of what problems are people having today and how can I help you to solve them? So it's, we do a lot of therapeutic listening. Since I have a master's degree, I run a lot of groups on the unit. So I do a men's health group. I work with illness management, recovery. I do like therapeutic interventions for people that just need someone to talk to. So it kind of runs the gambit. We do a little bit of everything.
That sounds really interesting. And I'm guessing that your patients are staying with you quite a bit longer than a typical patient in a med surg unit where the turnaround is much quicker, right?
Yeah, so at New Hampshire Hospital, our admission units, our goal is to discharge within 2 weeks. So when we take people in on one of the acute admissions units, we hope for them to be able to be discharged back to the community within that 14-day period. And that doesn't always happen. There are definitely some significant barriers to discharge for some people, but my unit in particular is more of a long-term care. So I have patients that have been there anywhere from 3 months to 3 or 4 years. And we
Mm,
have some people with us for quite a long time, 6, 7 years plus. So
wow. Okay. And that must create an opportunity to really develop a relationship with the patients over time as well.
it does. Yeah, we have a great opportunity to establish rapport with them and to really, be a part of their life. But at the same time, it's a double-edged sword because you also have a lot of boundary issues sometimes in that field as well. When you spend so much time with just a select group of patients, you really have to be mindful of what your boundaries are with them as well. So.
Good point. So I'm wondering how COVID-19 impacted the care at New Hampshire Hospital and your role in particular.
Yeah, I think COVID-19 hit us all pretty hard. I think it changed all of our practices pretty significantly. But one of the difficult parts for us at New Hampshire Hospital is that we are kind of a residential facility in some ways. So I have patients that have been there for a very long time and aren't going to be discharged anytime soon. And COVID-19 has impacted us in a few ways. One being that we had to lock down our facility in order to prevent the spread. So that meant not allowing visitors in for quite some time, not allowing patients off the units, even at the peak of cases in New Hampshire. And so we had patients that were kind of going a little stir crazy, kind of locked into the units for quite some time just so that we could help control that spread. And
Mhm.
that I think was kind of a negative impact of COVID for us. But on the plus side, because we did lock down, we actually did not have very many cases of COVID-19 at our hospital, and we were able to prevent most of our patients from getting sick. So it was very difficult in that regard. But it's also just been a struggle getting people to appointments because a lot of the other medical facilities have been closed down. We've had a difficult time getting patients to dental appointments, getting patients to physical appointments. And then, of course, discharge has become very difficult for a lot of our patients that are looking for housing in the state
Right.
because we've both had a significant decrease in the availability of housing statewide,
Mhm.
but also a lot of the transitional housing facilities closed down for a period of time during COVID-19 and stopped accepting new admissions because they were trying to limit the spread at their facilities as well. So we've had kind of a difficult time for the last several months getting people into the next stage of their care. So.
Okay, that sounds like it's had a significant impact there as well. But it's amazing that you really were able to limit the number of cases in the hospital so that you didn't have widespread there.
Yeah, that was a big plus for us.
Excellent. So the last question is, what advice would you give for a new grad who's interested in your specialty? And if you have any pointers to share as far as certifications or additional trainings or other things they might consider if they were interested in this specialty.
Yeah, so my number one tip to all new graduates is find a nurse residency program. Whatever specialty you go into, find a nurse residency program because it is a huge help transitioning from being a student nurse to being, a full-fledged nurse out there on your own. Um,
I love
And
that. That's great. I
yeah,
actually managed a transition to practice program last year, and it was a lot of fun for me. And I know the nurse residents absolutely loved it as well. So that's great advice. Thanks so much.
it makes a world of difference. And then as far as going into psych specifically as a specialty, um, I think that one of the things that is really important to remember is just to be kind and be caring. I mean, there's a lot of stigma surrounding mental illness, and there's a lot of expectation that people with mental illness may behave or present a certain way, because I think we're shown that a lot in the news and in the media.
Mm.
Um, uh, every single person is unique, and just be kind, be caring, take the time to listen to them and to build a rapport with them, and that will go miles in your practice. And as far as certification and things like that, the primary certification that we look at is a board certified psychiatric mental health nurse.
Mhm.
And that certification, you actually need 2 years of nursing under your belt before you're able to acquire that. So I recommend that anybody who's going to go into psych start thinking about, getting ready to study for that exam and sit for the boards as soon as you possibly can, because it definitely makes you more competitive. It will help a lot in your how much you're getting paid and things like that as well. But also it gives you a lot of insight into kind of the field that you're in. Aside from that, we don't really require a lot of certifications. I recommend that people, if they're going to come to a facility like an acute inpatient psychiatric facility, take the time to take a like a management of aggressive behavior course or a CPI course or something like that, because you do come across people who are very agitated at times, and being able to de-escalate that instead of having to resort to seclusion or restraints, which are non-therapeutic interventions to manage aggression, makes a lot of difference. If you can de-escalate those situations ahead of time and recognize them before they really get to a point that they can't be managed, um, is it's a great skill to have in psych.
Richard, can you just reiterate what were I didn't recognize those initials that you mentioned. Um, was it
Oh,
TBI or
CPI.
CPI? Yeah.
Ooh, I'm blanking on exactly what it stands for right now, but it's very similar to the management of aggressive behavior course. It teaches you interventions for de-escalation of aggressive patients. It also teaches you how to safely manage a hands-on situation if you have to go hands-on in order to help protect someone from either harming themselves or harming someone else. Because it's really important that even in those situations you look after the safety of your patient, primarily. So,
Right. Is
and
it
the safety
something that you
of the
learned on the job, or were you able to have training
yeah.
beforehand?
New Hampshire Hospital does offer that training when you start. It's part of their orientation program.
Mhm.
I also had done several courses before through the Community Mental Health Center, and
Oh,
there are some community resources that you can use to take courses like that as well, that count towards like your continuing education credits when you're trying to renew your license and things like that. So.
oh, that's great. Excellent. Well, thank you so much. Is there anything else you want to add? Anything we didn't hit on that
Yeah,
you want to
the
share?
the last thing that I would add is just for everybody out there, whatever specialty you go into, don't forget that every single one of you is going to be a psych nurse at some point. You're going to have behavioral patients, you're going to have psychiatric patients, and you're going to have people who have experienced trauma, people who are going through a really hard time in their life, and just remember to be kind and compassionate. And even if someone's acting erratically, just do your best to be there for them as a human being, because every single one of us is a psych nurse at some point.
That's great. I love that. I was actually waiting for you to say that. Something that I think, is mentioned quite frequently in nursing school and then throughout is that, we do all end up being psych nurses no matter what field we go in. So great advice. Thank you so much. And
You're very,
thanks for sharing your talents with us today.
thank you for having me.